is just a huge honor for me today to be podcast interviewing Jim Poyak, DDS IBO. The IBO stands for the International Association of Orthodontics. He's originally outside of Cleveland, Ohio. After he graduated from Case Western Reserve University School of Dentistry, he married his wife, Susan, and they moved to Virginia Beach, where he served as a dentist in the Navy. In '74, he moved to New Hampshire, where he started his first practice. While the practice was getting started, he worked 2 days a week as a dentist in the state prison. He later became interested in doing orthodontics on a limited basis in New Hampshire and continued to learn whenever he could about more advanced ortho procedures. His desire to learn led him to get involved with the IAO, the International Association of Orthodontics, an organization of over 2,500 general dentists from around the world who want to advance their knowledge of ortho. His pursuit in CE led to getting his diplomat with the International Board of Orthodontics. In 2016, he served as president of the IAO and had the opportunity to travel to Krakow to speak twice. His desire to grow both personally and professionally has led to his recent attaining as diplomat in the AADSM after completing a mini residency at Tufts University in Boston. He also completed several courses with Spear Learning Center and Dawson Center. Travel has always been something that he has enjoyed doing, and part of his travel has been on several dental mission trips. First to Jamaica, then to Haiti. Last year, he and his wife traveled to Israel for 14 days on a tour of the Holy Land. It was one of the highlights of all of his travels. He's also an avid scuba diver. My God, Jim, I'm going to live my life through you vicariously. I love the Holy Land. When my dad passed away, Mom was out of gas, and I sent her and her girlfriends to Israel. That just lit her back up. And then I just got to spend a week there lecturing. I forgot how long ago, about 6 months ago, before the pandemic. It was one of the last trips, and it's amazing how many dental innovation companies they have. I mean, there's just so much dentistry going on there. Everybody wants me to ask my guests, Jim, would you take the vaccine yourself today?
It's interesting. The answer is no. But I had signed up for it. And what happened was I had a hard time with signing up, figuring out how to go through the protocol. Finally thought I had everything signed up on my cell phone, Howard. I went over there at the assigned time, and they told me that I wasn't registered. And so what do I do now? And they said, well, you'll have to re-register, but there's no openings through the end of March. So I said, you know what, forget it. I'm just going to hang on for a while and see what happens. And then I just started listening to more people. And it's not that I don't think that it's not safe right now. It's just, I just want to let some other people test it out. And it's kind of like with some dental products. I don't want to be the first guy to buy it, but I don't want to be the last guy to buy it. I want to let it get field tested a little bit, and then I'll do it.
Oh my God, we could do a whole podcast on buying things too early that didn't pan out for us later. And what's so sad is us old guys take advantage of these young kids who are all bright-eyed and bushy-tailed, and they run around the corner. The one that really made me struggle was when they instead of a bone grafting material, it was Megagen, had that bone crusher where you could throw an extracted teeth in there and it'd pulverize it. And it just looked like, oh my God, this would be awesome. But it's like, you never know. Remember Art Glass? Out of, what was it, Colzer out of Indiana, where they delaminated. Remember when Ivoclar came out with Targus Vectrus? And I don't know what Targus was and what Vectrus was, but they obviously got a divorce after about 3 years and started delaminating. I remember Jim Glidewell. He was so upset with the Art Glass. He sued them and won. And a lot of dental R&D is just get it to market and sell it to us. And you have to stick your tongue in a light socket a few times before you say, oh, is that brand new? Well, let's let all the young kids try it and see what it looks like in 5 years. I mean, gosh, you just don't want to be on the bleeding edge of dentistry. Orthodontics is kind of a strange deal because these kids, when they're in dental school, if they want to do a molar root canal, every endodontist will help them at school. They'll help, everybody. If you want to pull a tooth, the oral surgeon's right there to help you pull the wisdom tooth, whatever. The periodontist, everybody's trying to help you learn in school and learn and learn and learn, except for one profession, the orthodontics. I mean, they keep the curriculum so that it's like embryonic facial growth and development. You know, they just want to get their electives out to make sure you didn't learn anything ortho. I mean, and now I felt like there was this big competition between the orthodontists and everyone else, but it took do-it-yourself braces. It took Smile Direct Club for the orthodontist to realize that's our real enemy, and the enemy of our enemy is our friend. And it seems like that Smiles Direct Club and Do-It-Yourself Ortho brought orthodontists and dentists closer together, because now they finally realize they've always been on the same team, but it's been really hard. Any orthodontists that go lecture, like who's the guy with Force in Detroit? Rick. But anyway, he was the only board certified orthodontist. He ran the program at University of California, San Francisco for a decade, then University of Detroit. And he said, I'm the poster child for this. I started teaching general dentists, and I've been blackballed ever since. And, you know, he says he's just toxic, and anybody who does it is toxic. And you look at the orthodontic instructors, they'll come from Canada, like Brock Rondeau, or they'll come from Australia. But my God, if an orthodontist best idea in Arizona was to start teaching general dentists clear aligners or ortho, my God, it just they get blackballed. Do you agree with that, or do you not agree with that?
Yeah. I started this.
Richard Litt, that was his name, Richard Litt.
Yes.
Yeah, Richard
I
Litt.
started this in probably 80s. When I moved out, I started dabbling in it when I was in New Hampshire. As I said, I was just doing things like uprighting tip molars. That was all that I was really doing. And then I came out here, and then I started doing some of the courses over in California. Skip Truitt was one of them. He was doing a lot of, but there was a guy, and I don't know if you ever knew him, Walt Barem. He had a company called Ortho Organizers. It's been now acquired by Henry Schein. Well, Ortho Organizers, it was Walt Brem was giving these courses, and just like you said, he was blackballed. You know, they wouldn't sell to him. They wouldn't sell him any supplies. So he said to his son, Lindsay, he said, okay, he said, I'll tell you what, Lindsay, he said, you can start selling my instruments for me. I'll buy them, and then you can package them up to the general dentist. That became known as Ortho Organizers, which Lindsay then sold later on for beaucoup dollars. And he started literally in a closet because they wouldn't sell the instruments to Walt Brem.
Isn't that wild? And yeah. And so how's Skip doing now? Is he still doing that?
He's still teaching. Yep.
Wow, that is amazing. That's a name. And when you were in Krakow, was that with Marcin Dolecki?
Yes. Yes.
My gosh, that was these names are so fun and familiar. So what would you say to a young kid? When I look at the economics of dentistry, I mean, it started 2 centuries ago with Pierre Fauchard, came here a century ago with G.V. Black, but since we've had really good macroeconomic data since I'd say 1950 on dentistry, from 50 to 20, dentistry's kind of flat. It kind of grows with the economy, kind of grows with inflation, except for 2 areas, and that's clear aligners and implants, and they're double-digit growth. So any young kid coming out has got to be looking at the macro, saying you gotta pick one of those 2 roads. I mean, if you're just gonna have a dental office that says cleanings, exams, fillings, that's going to be a pretty low growth industry. But clear aligners, I mean, Invisalign. I mean, you go to Cambodia, and if you're at the restaurant, the waitress finds out you're a dentist. First thing she'll ask you is about Invisalign. So, do you see clear aligners and ortho? Is your ortho future more clear aligners? Is it brackets? Where are you at in the ortho world?
It's been both. 20 years ago, 20 years ago, everything was just, brackets and interceptive ortho for kids. And now, as my patients have gotten older, Howard, it's become more Invisalign, and people are more open to doing Invisalign. Even minor orthodontics, they'll come in, my gosh, they had ortho and they had relapse of a couple of lower teeth or upper teeth. They want to fix it, and so they're willing to go ahead and do the Invisalign. So I see a lot more people interested in Invisalign Invisalign, and it's something that's easier for the general dentist to learn. I mean, they can learn that, and in relatively short time. Whereas if you're going to start doing fixed brackets, it's just a lot more involved. And like you said, you look at the macroeconomics of it, it's just a lot more affordable from a time perspective just to do Invisalign than it is to do anything fixed.
So there's so much technology in this. I mean, there's so much technology that they're trying to do it yourself. I remember when these centers started opening up. So Invisalign started setting them up, and Smiles Direct Club, and then there's a lawsuit, and I think Invisalign had to close theirs down or whatever. But I noticed there was two knee-jerk reactions. Of course, one was all the locals like, "Did you see that one open?" They're all upset. And then the smart ones were going over there and trying to learn from them. I mean, to get that cost down, why do you have to see the patient every single month for 2 years? Maybe you could see him in less months, or maybe you could give him 24 retainers, maybe instead of every 30 days, every 15 days. But there's got to be some innovation. I remember when Orthodontic Centers of America came out. I remember when I heard Gasper Lazara speak the first time, I thought, damn, I never thought of that. And this is what blew my mind. He said, imagine you go get your haircut every month. And the barber said, well, Howard, every time you get your haircut, it's $100. And so we're going to sell you a 2-year plan. It's $2,400. We'll need $1,000 down, and we'll finance the rest at 8%. And you'd be thinking, well, why the hell am I financing and prepaying? Are you gonna prepay your rent, mortgage, equipment, staff, electric bills? Why are you prepaying for this? And he says, look at orthodontics. He says the brackets are $100, the PA's $1, the pano's $1, the study models are $1. I don't even have $100 into this, and you're saying it's $6,500, and you need $2,000 down, and then we got to apply for it. He says it doesn't even make sense. So they rolled out a deal that said Orthodontic Centers of America, it's $199, no interest financing, no down money payment, no money down, and just like Walmart, who 1% of their wholesales returned, he only had 1% of his Orthodontic Centers of America patients in brackets leave and never come back. 99% were saying, oh my God, no money down, $199 a month. And he just made it affordable for a lot more people. And it was massively successful. But it was a rollout, meaning he just got a big bunch of money and bought orthodontic offices. They had to stay for 3 years. And into the 3 years, no one stayed. They would just leave. And, that was the end of that. But there's got to be some. If you tell me there's no innovation and Smiles Direct Club, or now there's 40 different do-it-yourself ortho companies, you got to steal their best ideas. You can't just say they're all bad and there's nothing good in them. There's got to be something there. Have you picked up anything from their business model, their technology, their scanning, their making your own trays? Have you picked up any of that for your operation?
No, I haven't, because, part of the issue for me is that because of my age, there are things that I haven't jumped into. And like you said, just from a cost benefit standpoint, some of the things, it just doesn't make sense for me to jump into, a milling machine that's going to cost me, the scanner, it's going to cost me over $100,000. I'm not going to be around long enough to recoup my investment in that. So to be honest with you, I haven't. I've just pretty much stuck with Invisalign. I've tried a couple of others, but I've always gone back to Invisalign, and I've just used those.
Well, what you're saying is pretty profound, because on OrthoTown and on Dental Town Ortho section, when people were really complaining about them opening up stores or doing this or doing that, I noticed that when people said, well, are you going to quit using them? And they said, no, I'm not going to quit using them. It's better. Their tray material has more science in it than anybody realizes it. And it's just not trading Invisalign for something that you would make a night guard out of. They got serious technology there.
Yep. Yeah, for sure. Yeah, I've seen it, change from when I first started it.
So what percent, if you did 100 cases, what percent would be wires and what percent would be clear liners?
Oh gosh, now it'd probably be 80-20, 80%, aligners, 20% wires.
And is that a majority of your office or the majority of your fun?
No, that's my fun. That's just fun stuff. It's when people come in and they say they've never liked their teeth. Structurally there's nothing wrong with them, but they just 100% overbite, snaggle teeth, and when you can throw something on there and use some light force wires, and in 3 or 4 months time have them looking pretty darn good. And the people going, hot dog, can I get them off next month? They look great for me. That's fun.
Yeah, I think it's tough because if you look at healthcare and medicine, especially in the United States from 1900 to, 1900, it's 1% of the GDP, no specialties. By 2000, it's 14% of the GDP with 58 specialties in medicine and 8 in dentistry. And now it's just 2020 with 1, and we're already up to 12 specialties. And there's just so much. Right now, you cannot come out of AT Still or Midwestern and know enough to be competent in oral surgery, endo, perio, pediatric,
Yeah.
ortho, pros, dental anesthesiology, oral facial pain, oral med, oral path, oral radiology. So what's really cool, you still got to diagnose it. You still got to talk to the patient. You don't have to do it, but I think that everybody should rotate through these specialties so that they can talk the language, diagnose, treatment plan, be able to talk to the patient, but then keep them from burning out.
I think one of the reasons that I liked ortho so much was that it gave me a better understanding of everything that I was doing. If I was going to do any treatment planning for major crown and bridge cases, it didn't mean that I was going to necessarily do any I wasn't going to do surgery or anything like that. But I might look at it and say to the patient, if we did orthodontics here, we could do such and such and such, and it would make the results look better. It just I understood more of what I was dealing with, not necessarily that I had to apply that, but at least I felt that I understood better. And when I would take lectures and people were talking about self-analysis, and it's like, oh yeah, I'm comfortable with this. I know what they're talking about. And that's really one of the benefits that I saw of having a better understanding of orthodontics.
Now, when you left Case Western Reserve Dental School, how many hours of sleep medicine did you have? My God.
What was sleep medicine was what I did the first 2 hours of every day in class.
Oh, that's a good one, man. That's a good one. My God, it just came out of nowhere and it hit everybody by storm. I remember the lady with the Huffington Post. She wrote a book on it. I remember it was getting a lot of newspaper sale because she was blaming these historical figures who had done crazy things on lack of sleep and all that kind of stuff. But there's still a lot of older people who are calling this a fad. Where are you at in sleep medicine? Do you think how much of what you're hearing out there is new and excitement, but fad and won't pass the test of time?
It's a good question. It's always easy to take something like that and for people to abuse it. For people to say, "Oh, hot dog," I'm gonna get trained in this, and then I'm gonna go out and I want to be a lecturer, and I want to be the Howard Friend on sleep medicine. I want to go out and I want to lecture to people all over the world, and I'm just going to espouse anything that sounds good. Throw those guys aside. I think that there's a lot of truth to a lot of the things that are going on. I see it with a lot of my patients. One of the first guys that I did was a patient that I've known for a number of years, Howard, and he came in and I didn't even end up making the appliance for him. I did a home sleep test for him and said, hey, I need to get you to a sleep doctor. He put him in a CPAP and he came back to me and I asked him how he was feeling. He said, man, I'm feeling, great. But he said, my question was, why didn't my cardiologist ever tell me about this? He said, this stuff's affecting my heart. And I said, yeah, that's a good question. So, those are the concerns that I have, when you start looking at the inflammation that it can cause for people, the effects it can have on people that have cardiac disease, AFib, strokes. You could go on and list all of the different, possible sequelae from it. How much of that is going to actually be strong, that I don't know. I'm still learning it because the whole thing is so new to me. It's so new to all of us that what we know now we didn't know 5 years ago.
So, what would you say to a young kid who's in AT Still over there in Mesa or Midwestern over in Glendale, and they say, when I get out, I want to do bleaching, bonding, ortho,
Mhm.
clear liners. You know, they want the pretty fluffy stuff as opposed to the blood and guts. And usually I can tell by looking at their first root canal. I mean, if it's all dainty and they stayed a half millimeter from the apex and they're a pulp lover, they should go into bleaching, bonding, and ortho. But if they love to see a puff of sealer blown out the apex, if they're an apical barbarian, they're blood and guts, and they need to go into extractions and implants. But what would you tell a pulp lover who wanted to learn Invisalign how to proceed?
Who wanted to learn Invisalign?
Yeah,
Oh, I would
or
say
clear
go.
liners.
Yeah, go for it. It's got to be something that you really like to do. And if you want to learn and if you want to incorporate it, like I said, I went into it because I just wanted to learn how to do orthodontics because I thought it'd be fun to do. But for me, I just learned so much more once I got into it that was really that was a perk for me. That was just as much, I got as much out of that as I did doing the ortho, Howard. It's just the way that I was able to apply that knowledge to everything else that I did in dentistry.
And the cross training is amazing. Like if you look at every legend in dentistry, it was usually they added two things together. Like there was silent movies and phonographs for 40 years before somebody decided to put that together. And it was even a worse atrocity of how long they looked at chocolate and peanut butter before they added that. But like Carl Misch, he was a removable prosthodontist doing a denture and the only thing that made him go into the implant still is the oral surgeons were having all their implants break and were blaming it on the implants. And they're like, dude, your bite was horrible. I mean, everything was wrong with this denture, the bite, the function, everything. And then, of course, the implant couldn't stand it any longer and died. And it's not the titanium, it's you. And so him having that base in removable made, with so many insights. So 1 + 1 = 3. I mean, we see it in business too. Like, look at ClearChoice. They took we're going to take the implant surgeon, the prosthodontist, the lab guy, put it all under one roof, and how that company exploded. It's been bought and sold 5 times. Pediatric dentistry in our own backyard. When I see a startup pediatric dentist start up with an orthodontist, because everybody's going to ask the pediatric dentist, will my kid need braces? Oh,
Sure.
well, here's a referral form. You got to go down the street, talk to a different
Yep.
stranger. They put them under one roof, they explode. So, it's a magic formula. What advice would you give these kids that were interested in ortho?
If they're interested in ortho, and they really wanted to learn more about it, I would tell them look around at some of the really good courses. Like you said, and throw out some names here, like Brock Rondell. I would check with the IAO, honestly, and I would find out who's giving the courses, in their area, and they'll tell you. And the guys that are giving them are really knowledgeable. They're well trained. There's some great guys out there doing it. I know some of the guys that are doing it with Brock, and they're really smart guys. I mean, they know their stuff, and take some of the courses and see what you think. See if you like it, and start with the easy stuff. Start with the class 1 cases. Start with uprighting, a couple of tip teeth, or lining some, minor crowding and the lower anteriors. See what you think. And if it rings your chimes and floats your boat, do it. If not, it's like, hey, great, you checked it out. It's not for you, and move on.
So you like the IAO, and that is so their website is iaortho.org.
Hmm. Yep.
Christopher McKay is the executive director, and tell us about that organization and why you decided to join it and were such a big part of it.
Um, it again goes back to Walt Brehm. When I was doing the courses with Walt Brehm, he also had a study club, and we would go over there, I think every 3 months, every 2 or 3 months for a number of years. And he would lecture, and we would bring cases over, and we would sit there and discuss them. This guy was so gracious and so willing to share anything that he knew with us. It was just amazing. I mean, when I was in dental school, you talked about ortho. When I was in dental school, we were just learning how to do real simple things, make a helical loop or something like that, make a space maintainer. And I remember that I had a question. So I went up to the instructors, and he said, let me see that. And he took it and he went, there you go. And I said, what'd you do? And he said, don't worry, you'll never have to do it. It's like, yeah, I mean, you talk about protecting. Walt wasn't that way. He was, hey, we'll stay until 7 o'clock, whatever you want to talk about. We'll talk. I'll help you in whatever way I can. So he was great. So that's really what got me started in it. And as a result of that, then he said, hey, you guys need to join the IAO. And he was, I think Walt was one of the founders of it, if I remember right. There were about 4 or 5 guys that founded it, and Walt was one of them. And so I joined. And at first I was just, one of the guys and just going to some of their annual meetings. And then somebody approached me and they said, hey, are you interested in becoming an officer? And I said, yeah, I'd like to know more about it. So I started out and just kind of went through the ranks. And after about 5 years, worked my way up and I was president. And it was great. It was a great part of my life. I always look back on that, and I have to say that was a positive experience for me.
And where does the junction? I mean, you also are you got your diplomat in the American Academy of Dental Sleep Medicine, and you got your diplomat in the International Association of Orthodontics. I mean, where Main Street runs into First Avenue. Where does sleep and ortho? Where's the intersection there? And did you find learning sleep medicine with your foundation and orthodontics helpful?
Yeah,
How,
yeah, I
how
did.
does that peanut butter and chocolate go together?
Well, that's a good question, because a lot of times, if you look at one of the things that people are predisposed to having, if they're going to have sleep issues, is that they're going to be a skeletal class 2. They're going to have a retruded mandible, so the tongue doesn't have anywhere to go, especially if they've got a narrow crowded arch. The tongue is further complicated; it doesn't have anywhere to go, and then they throw themselves on their back at nighttime, and this huge tongue with this narrow arch and maybe some tori down in there says, hey, where am I going to go? It's going to go in the back of their throat. So they start snoring and maybe they don't even know that they have sleep apnea. And then you start running some home sleep tests, or if you want to go in and do the sleep lab, you do that. And you start to find out that, hey, some of these people sometimes have got some pretty severe problems. Guy was just in the other day and he said, my wife's telling me I want to snore. He said, so I want to do the test. We did the test and he came back with a number of 48. Anything over 30 is severe sleep apnea. You know, Here he is thinking that he's snoring and he's got severe sleep apnea. I said, here's the sleep physician you need to go talk to. Sleep physician, you need to go talk to him. So when I look at him, a lot of what I'm looking at is I'm looking at orthodontic situations that could be contributing factors. If I start to see wear on the anterior teeth, Howard, we used to think that it was because of bruxing. It still can be, but a lot of times what the reason is that they're bruxing is they're trying to open their airway. And so that they're a class 2 case, they stick their jaw forward and they chip and abrade their upper and lower incisors. And you look at it and you go, well, how does that ever happen? Well, they're trying to open their airway at nighttime. And they've done some studies to find a correlation between bruxing and sleep arousals. So there's a correlation there, but I just find that the two of them, for me, again, go hand in hand. And a lot of times I'll tell people, part of it, if you're young enough and you want to really treat the problem, is maybe we need to look at doing some expansion. Same thing with kids, get the kids early enough and you can start to do some expansion on these kids. Even, if mom and dad come in and they say, hey, the kid snores. We used to say, oh, don't worry, they'll outgrow it. Well, they may, but maybe there's some other issues there. And again, if you see a lot of crowding in there, you see a narrow constricted arch, get them in a rapid palatal expander and refer them for an ENT evaluation. And usually if you can create enough room, get the tonsils out of there, the problem resolves itself and the kid doesn't have any sleep issues later on.
So where did the motivation for all this come from? I mean, some dentists want to do TMJ, some people want to do all these things. Where do you think the passion? I mean, when you talk about this, you can just tell this just lights you up. I mean, you're very passionate about this. Where does that come from?
Just a desire to always learn. The sleep was personal for me, because I was one of those guys that my wife would, give me the elbow and she started to say, hey, you're snoring. So finally I bought a home sleep test and I started doing the tests on myself at home. And I said, holy cow, I said, I've got a problem. So I tried an oral appliance. and I couldn't do it because I'm one of those guys that I've got bilaterally displaced discs. My maximum opening is like, if I can get one finger in there, it's good. Maybe two, three, forget it. It's never going to happen. So I couldn't bring my mandible forward. I'm a skeletal class 3. I just couldn't come forward far enough to be able to open up the airway. So I ended up having to go into a CPAP. But it was just all of this that just started, it piqued my curiosity, and I started going and doing some research on it. I said, hey, I want to learn more about this. It was just an interest that I had. And it was the same way with orthodontics. I just said, I just want to know more about this. Funny thing is, my family says, I think, Dad, even when you retire, I think you're still going to want to take continuing education courses and still learn about dentistry. And I said, I think you're right. I just have this desire just to learn more and more. So where it came from, I don't know, but that's really what it is.
Now, do you where do you think you spend more of your time practicing and studying? Is it more sleep, or with the American Academy of Dental Sleep Medicine, or is it more, would you say, ortho?
Um, right now it's more, I would say it's more, it's kind of getting to the point where it's balancing out. Right now it's a little bit more ortho.
A little bit more ortho. And do you think, where do you think these, I mean, I know it's a crass question, but these kids got $400,000 in student loans. They gotta create a supply of what people are demanding. And I tell them, like, if I went to Childress, Texas, I'd have a Ford 150 dealership. I wouldn't have a Mercedes Benz or an electric Volt from that. You got to know your market. What do you think is a bigger market for these kids? Clear aligners or sleep?
My gut thought is that my experience, let me back up. If I look at my history of my life in dentistry, however, it's been a bell curve. So if I was 30 years old, the peak of that bell curve tended to be around age 30. When I was 60, that peak tended to be around 60. So I think it depends on the age of the individual and the locality that you're in. I think it's hard to say across the board, because if you're practicing in Sun City, then it's not going to be ortho. It's going to be sleep dentistry. But if you're practicing in a town where there's just primarily a lot of young people and not that many older people there, then I would really look at the ortho, because you can do a lot of orthoceptive things in orthodontics with kids. Just functional appliances. That's really how I got started with it. It was Skip Truitt and his functional appliances that really got me started.
My gosh, that was a blast from the past. I haven't heard his name in a long time. The other day, somebody is podcasting mentioned Walter Haley, and I thought, my God, and I mean, he passed away in 2003.
Wow.
And this is 2021. He's been gone 18 years. And you and I lost a friend this year, Omar Reed, which is what I associate with the beginning of the pandemic, because that was, you heard about it. You didn't really know if it was going to change much of your behavior. And then I started realizing, oh my God, his funeral, I know people are flying in from every corner of the world. And people are saying, they were coming in from Iceland and all these countries. And I thought, that's probably the worst place to be in the world right now. And I felt so bad. I did not go to his funeral. I thought, God, there's probably going to be, it was just, it was the beginning of the pandemic. But my gosh, we've seen so much change in ortho. When you were learning ortho back at Case Western, did you ever think it would be this much digital electronic?
Oh, no. I mean, that was back in the dark ages. That was, it was so long ago, Howard, that my sophomore year, it was a brand new dental school, and they've now built a brand new dental school again. So that's how long ago it was.
Oh, yeah, that is,
that makes me feel old.
That is, wow, that is well said. So how is the pandemic affecting you? Like in our practice, we're down in Ahwatukee, and basically, Ahwatukee started as kind of more of a retirement center. When I got there in '87, it was all retired people for at least a couple miles all the way around. And then as it filled out, now it's all, all ages and all that kind of stuff. But to me, Arizona's, there's two groups of people in Arizona. There's like my 4 kids and mom who couldn't care less about this virus. They think the whole thing's crazy and overblown and a hoax. And they've been coming in and working, and they're all busy. But they don't need anything. They're just needing cleanings, exams, fillings, those stuff. But the elderly who need all the major dental work, they're hunkered down, and we have not got back to our pre-pandemic levels of
Yeah.
of collection. You're in how far are you? You're up in North Scottsdale, right?
Yeah, I'm
Um,
just off of Shea and the 101.
yeah. So the average, I think the median age of where you're at is they died yesterday. Um, so are you still seeing that? Are you seeing a lot of
Oh yeah.
elderly people in Scottsdale still hunkering down?
Yeah, yeah. I ended up cutting my practice back by a half a day a week, or well, I probably even see a day a week, because of that. And my hygienist is busy, but I have holes in my schedule for that same reason. If people are coming in and either they've already been restored, they've had everything done, or I know when we call the people, it's like, oh no, I'm not ready to come in yet, not ready to come in yet, and so our numbers are down too. So I read somewhere in one of the journals, I've heard anywhere from 20 to 30% reduction in patient visits. So what do you think? Do you think that's about right?
Yeah, only we just passed the 10% of America got vaccinated. I mean, so the 2020 was dead on arrival, and I remember in Beeville, Texas, with the over Christmas with the grandkids. Reading a little bit about this and virus in China, and and it's Christmas and a little bit, but it didn't really get serious until March, and
Yeah,
then we had to close down 2 months and it was dead. But 2021, I think there's light at the end of the tunnel. I think there's Arizona, which I call the Florida of the West. I mean, Arizona and Florida. I mean, if those aren't cousins or twins or whatever, including my whole family, half of the state doesn't believe in it, doesn't care about it, thinks the whole thing's stupid. But again, they just tend to be the younger people that need cleanings, exams, and fillings. They don't tend to be these older people that need all the advanced work.
yeah,
And but I think that as soon as we reach herd immunity, whatever that is, we're at 10%, probably need to get to what? 60-70% of the population. I know
yeah,
you're not going to get a quarter because I worked on the water fluoridation campaigns in 80. I got here in 80. You got here in 85. I got here in 87. We got the water fluoridation in 89, and then we had to renew it 20 years later. And that was my first experience with the public in a big way. And I mean, they were telling me the exact same conspiracies. You show them literature by the CDC and they throw it down. They say, oh, they're just a shill for the pharmaceutical. And I'm like, dude, I've been to Atlanta. I know these guys. They'd make more money doing dentistry. And they're, but anyway, I knew. So 1/4 of Americans will not have anything to do with this vaccine, water fluoridation, vaccines of any sort. But do you think we'll reach 75% vaccination and your practice will be back to normal before the end of 2021? Or do you think it'll be more 2022 before you're back to pre-COVID numbers and levels?
yeah. I think it's going to be 2022.
Yeah.
I just do. I mean, I have the feeling right now. It's just, the way it's been going. It picked up. Right afterwards, we were doing okay, and we'd have some really good months. But then we'd have, when I look at the whole numbers overall, it's definitely down.
Well, like my staff says, I mean, my whole team will say that it follows the news cycle, and
Oh yeah,
when
yeah,
they're doom and glooming and saying it's raising or it's going up, we start getting cancellations.
oh
When they
yeah,
say it's coming back down, they start calling back up. You're at a real interesting intersection. Being a diplomat in sleep medicine and a diplomat in orthodontics, we just added 4 new specialties. I mean, oral facial pain, oral med, oral path, oral radiology. Um, did you like the addition of oral pain, oral med? Recently, or did you think, yeah, that was well needed, or did you think there should have been one in sleep medicine? A lot of people thought there should have been one in implantology, but where did you rein in on these new specialties that have been added?
anytime that there's something that I don't really understand, I'm thankful that there are specialists that I can refer to. And when it comes to some of those things, oral meds, I'd rather just Like pathology in dental school, I hated pathology, oral pathology. That was my sleep medicine every morning. They would dim the lights and they would show those slides and oral path, and it was like, oh boy, I just couldn't stay awake. So, I'm thankful for for specialties in those areas, Howard, so that I can refer people to those areas when I can't deal with them.
Yeah, and you talk about oral medicine. I mean, there's 132,000 registered antibiotic pharmacological chemicals with the U.S. government. 132,000
Wow.
chemicals in the pharmacological class. I mean, how in the hell could you know all of that? It's nice that when you're in over your head, and also it's nice when you don't have the chemistry with the patient. A lot of my referrals, I can just tell the minute you realize that it's going to be really hard for you to like this person. I always think if someone was doing a bypass on me, I wouldn't want him to thinking, damn, I hope that dumbass dies during on the table right now. But yeah, and that's another reason I don't like cosmetic dentistry. And it's why I actually, I got to tell you a story. That's when I did the demographics out here. I was looking for the two best demographics, and it was A5044, and it was at 101st and Via Linda.
Oh my
And
gosh.
I specifically in '87 went to Ahwatukee because when I drove around up there, it was richer people, well-to-do, whatever. It just didn't look like Kansas. I mean, I was born and raised in Kansas, went to Creighton, Nebraska, Missouri. I just always felt more at home in the more in the lower income, middle class. I'd rather sit with I'd rather be in a dental missionary camp than in some castle. You know what I mean? I just don't relate. Some people really relate to that. So when they come in my office and, they're being all silly about their veneer and all this stuff like that. Oh, I just love to send them to some guy. Well, this guy has a fellowship in the Academy of Cosmetic Dentistry, and this is all he does. And oh my gosh, it's so nice to be able to get him out of there. Do you think, if we got 8 the first century, we got 4 specialties in the first 20 years of this century, so we're on a 4 times 5. We're gonna we added 8 last century. We're on the path to probably add 20 this year or this century. Where do you think the next specialties will be, or where do you think they should be?
I wouldn't be surprised if it was in sleep. Just because it's growing so fast and there's such interest in it. Gosh, I don't know what other options could there be. We've just got four of the new ones. Implants. Yeah, implants. I would say it's probably implants first. Implants and then sleep.
And when you're going into some like if you want to start placing implants, I usually see people digging a very deep hole, then raising their overhead every time. They got to buy a CBCT. That's could be 80 to 120 grand. They fly to Jamaica. They buy all these courses. They keep buying it, and a year later, they're placing like 1 implant a month, and they dug this deep hole and they don't go out, and they don't realize the overhead involved. Like oral surgeons, if you separate out the oral surgeons who just do exodontia, their overhead's about 40%, and the ones who place implants, it's up to 60%. So obviously, there's 20%. The implants that oral surgeons are doing are being subsidized by the excess free cash flow from exodontia. But so when you go into look at the overhead you would need to dig a hole to go into implantology, and a lot of these dentists will never even get back to zero. Compare that to the investment needed to get into sleep medicine or orthodontics.
Well, I can tell you when I went, there's 2 options two routes that you can pursue to get a diplomat. The simplest one is to either go to Tufts or to the AA, American Academy of Dental Sleep Medicine in Chicago. Both of them are going to have mini residencies, and Tufts is $9,000, and AADSM I think is $6,000. To my understanding, they're identical. It's just that Tufts is going to charge a little bit more because they're a dental school, and I'm not sure if there's any significant difference. Once you've gone through that, that's pretty much it. So your investment, travel time, depending on where you live, you might have 10, maybe $15,000 in sleep. That's it.
10 or
Um,
15,000. That's significantly less.
oh yeah.
Uh, there's significantly less than anything you could do in dentistry. These young kids from in our backyard, they ask us very clearly, and so you got here in '85, I got here in '87. Um, do you think it was easier for us back in the '80s to set up a practice and run an office and be profitable and all that than them in coming out in 2020?
Oh, definitely. Definitely.
And why is that?
Our overhead was less. I mean, when we came out here, um, gloves were just that was new. The fact that we even had to wear gloves. All of the OSHA requirements that you have now, all of the overhead, especially now during COVID. I mean, my gosh, I take a procedure that takes me 15 minutes, and we've got to schedule the patient for half an hour in a room because the assistant's got to wipe everything down. She's got to spray the counter. She's got to let sit for 2 minutes. Then she's got to wipe, and then she's got to spray it, and on and on. And all of this stuff, it just eats us up. And the cost of dental education. Oh my gosh. What was it when you went to Creighton? How much was it a year?
Well, I did Creighton undergrad, and that was 7 hours from home.
Okay.
And their dental school was, gosh, I can't believe I'm saying this on TV because my mom's still alive and listens to the show. But Creighton, they had summers off, and so you had to go home.
Yeah, yeah.
And UMKC Dental School was year round, and Creighton was a 7-hour drive to Wichita, and UMKC was 4 hours. And my mom's Catholic, so their birth control was Russian roulette. And I got a brother that's 17 years younger than me named Paul. And it's like, okay, Paul's there. I want to be closer to go see Paul. But I just hated leaving your lifestyle, then going home and live with mom and dad for 3 months in between. So I went to UMKC because it was public. It was half the price. It was year round, so you never had to live at home again. And it was closer to the family. So I went to UMKC there. But when I came out here in '87, I graduated May 11. I had my office open for no money down. 133 days later, I found my demographics. I did all the demographics in Kansas City. I went down to Caldwell Banker. They hooked me up electronically with a guy here named Dave Cheatham. I told him the demographics. He agreed, and they told me a place that they were building a Safeway with a Walgreens and Pizza Hut, and just a great place out in 85044, which was the best demographics. It was growing. They were building 90 homes a month. The population to dentist ratio was unmatched, and he told me that I could rent 1,000 square feet for I think it was $15 a square foot a year. And I told him, okay, I'll pay $20 a square foot a year for a 5-year lease if you do the build out. And so we got that done because my dad wouldn't give me a dime because I was a boy. He said he paid for my sister's college, but he said, you're a boy. If I give you money, you'll go to school and do drugs and do weird stuff with women, but you got to be a self-made man. So I'm like, okay. And so then we went to Healthco. Remember Healthco?
Oh, yeah.
It was bigger than Patterson or Shine. The other two weren't around at those times. Same thing with Healthco. I picked out everything I wanted. They said, okay. It was the same as my dental school tuition. It was about $87,000. I said, okay, well, I don't have a dime, so I just want this over 50 months or 5 years, 60 months. And so I had the lease doing the build out and a lease for the equipment. I opened up 133 days later, and there were no dental schools in Arizona. There was no water fluoridation. The adjacent state of Utah and Nevada didn't have any dental schools. And when I did dentistry, I would bill it to the insurance company, and whatever my fee was, they'd pay 100% cleaning exams and x-rays, 80% for root canals and fillings, and 50% for crowns. It was a slot machine. You couldn't even, if you just, and my hours were insane. I was like 7 to 7, 6 days a week. Do you remember Ed Silker when you got here?
No.
He had the Sunshine Dental Clinics.
Oh, okay.
And Ed was so cool. When they were doing the build out for 4 months, he'd let me work at Sunshine 7 to 7, 7 days a week while they were doing the build out. So I was doing my dental school everything I need to do to graduate. I was doing it like every week. It was just great meeting other dentists and all that kind of stuff. And then when I opened up, if I ever had a down afternoon or whatever, I could drive back to Sunshine and work there. Not just for the money, but the experience and all that stuff. But my gosh, now you roll forward 30 years. There's water fluoridation. There's 2 dental schools. There's
Yeah.
we're the only state that allows any licensed dentist to move to. So Arizona, Governor Ducey passed that law because they were going to Ireland to find registered nurses to work in Scottsdale because that was easier than getting some girl a nurse to get past state boards for Arizona. So he said enough of that. So he said if you're licensed anywhere in the United States, you can move to Arizona. And my gosh, now 18% of the dentists out here work for a DSO, and the DSOs are just getting bigger and bigger and bigger.
Yeah.
I remember over the Christmas, New Year's, I took a day drive all the way up to Flagstaff, over to Slingman, just driving all around all day. Even those little itty bitty towns had big build out DSOs. So do you feel the increased pressure from any licensed dentists being able to move here?
Oh, yeah, and especially from the DSOs too. I mean, I notice it with my own patients, people that will leave, because their plan changes. That's the other thing, this, like you said, when we first came out here, you had Delta. Delta was pretty good deal for all of us at the time, and we had all the other insurance companies, and you just did the work and you build them, and you didn't worry about it. Now, you get all of these. No, sometimes you're getting the same $1,000 benefits that they had, 40 years ago, which is ridiculous. You can do $1 a year and you're out of benefits. So it's a lot harder. And like you said, just other dentists, you got the dental schools. And plus the area is really, I mean, where I am here, Howard, there was nothing here when I moved in 1987. I was the first tenant of this building. I talked to a friend who's in real estate, commercial real estate, and I had somebody contact me who was looking for an office, and he wanted to buy like a condominium. And so I called Gordon and I said, hey, do you know of anything? He kind of laughed and he said there just aren't any dental condominium offices around, so this area is just so built out compared to where it was too. The opportunities right across the street from me is a Wells Fargo bank. And when I first opened up here, 2 patients a month would just come in and they would say, oh, I saw your name on the side of the building. Like you said, I mean, it wasn't a tremendous number, but you look at it, you go, wait, but that's 24 people a month. And then their families and then the referrals from those people. It was a lot easier.
So what do you so dentistry is it's obviously more competitive than it used to be.
Oh, yeah.
So the patient wins, the community wins, dental insurance companies wins, and that will all be at the expense of dental's power to price earnings. I mean, their power to price is on a downward slope. And it's been sloping downwards for a long time, but the specialist is still on an upward slope. I mean, so that's what these kids have to realize. Some of these market things are well above, anything you can do. There's just some things you can't control. And when you look at dental income, the specialists are going up, and the general dentist are going down the most. I mean, it's just math. Like right now, and 174 for general dentist, 322 for specialist. You look at, I mean, my gosh, you look at. I love these facts. Average dental specialist makes $320,000 a year. Average general makes $197,000. Dentists who own their practice makes $244,000. Dentists who are employed at a practice makes $147,000. So there you can see the math what the DSO can make. I mean, if the owner operator is making $244,000 and the employee is making $147,000, basically a dentist is worth about $100,000. And but the specialists are making another $100,000. So to specialize, you're at $320,000. And to be an employee, your general dentist at $147,000. Oral surgeons are still the king at $448,000. And some of them out here, even the first year out of school, net $750,000 right here in Arizona. I
Oh my
mean,
God.
my
Wow.
gosh, it's all because their fees. Like if I do a root canal, the insurance might give me $650, but if I was endodontists, they give me $1,200.
Yeah.
I mean, it's just so the insurances are responsible for a lot of this. Periodontist at 330, endo 307. Endo used to be as good as oral surgery, and it could come back, but they all got microscopes and became neurosurgeons and really slowed down their productivity. They used to bang them out an hour. And I remember back in '87, a lot of my endodontist friends would say, "Oh man, today was tough," and I'd say, "What was it?" And they'd say 9. It was always the number of molars. They didn't talk about anything else. Today was easy. I just did a 6 and went home. Oh my God, today I did a 9. And but they've just really slowed down. The time necessary to do their procedure has slowed them down, and so they're down to like 307. Pediatric dentists, 304. Ortho 289. Prosthodontist 219. Specialty is where it's going. Do you think so, or what are your thoughts on that?
Well, yeah, if you just look at the numbers, sure. Because how much can you make if you're a general dentist, like we were saying earlier? If we're sitting around and our practice is slowed down and the kids that are coming in don't need anything but prophies, and it's in sealants or, an occlusal composite every now and then, or you can be a specialist and you can do, and if somebody's in pain, they're gonna want to see you. If they're overdue for their hygiene appointment, hey, they can put that off for another 6 months.
And back to pain, right here in Arizona, the media kept showing us that that 8.5% of Arizona emergency room visits were odontogenic in origin, and that's our profession. Why do you think that is, and what do you think will have to be done about it in the future?
Wow, it's a good question. Why do people go? It's after hours. They find it more convenient. Weekends, they can't get in touch with somebody. Afraid of the cost. I don't know. I don't know what the emergency rooms would charge to treat something like that compared to going to a dental office. But I think the biggest one would just be convenience.
Right.
Although it's not convenient to sit in the reception area in an emergency room for an hour or two, but yeah, I think convenience is a lot of it, and give me the drugs. Just get rid of the pain. I don't want to go through the procedure, but just give me the drugs to get rid of the pain too.
Right, I completely agree. The convenience is huge. Plus, it's a place they've gone. It shows you that when when their mouth hurts, they're like, "Well, when my body's not working right, I go to the emergency room." They see the oral human connection. They don't. They go if it's an emergency, they go to the emergency room, and their mouth is part of their body, and that's where they go. And but it makes us realize. I told these kids and. You can get in a dental office with no money down. I did in Phoenix. Pew, PEW, the research has started off with oceans, and now their next entry was healthcare. They've already done the demographics. They already on their websites they show you all the underserved areas. So, like when you're coming to Arizona, I show them the Pew. And then they start immediately saying they want to go where you are. Well, I want to go to North Scottsdale because and they just think there's all this money up there, and they don't realize that in Scottsdale, only like 2 people live on an acre. When you get to a poor area, an acre might have a 16-plex on it and have 50 people in it. When you go to a county that has no dentist and you go to a town, whatever the size of that town is, the draw is that big again. And I've seen dentists, when they go to a town and they're the only dentist in a town of 3,000 or less, that's a 6,000 draw. They don't have to participate in the insurance. They have their fee deal. I was looking at one dental office the other day, and he's the only dentist in the county, and everything was an odd number, like crowns, dentures, all that stuff was just 1,000. He didn't have, there wasn't a 9 or an 8 or a 7 on any of his prices. It was like, oh, that's 1,000. Yeah, that's 300. That's 500. I'm like, wow. And but they don't want to go there. And I think that we were ground zero for driverless cars. The Google did their 5-year study right here. And I think when people sit there and say, well, I don't want to drive out there. Well, I think we're just around the corner from you. Just wake up, go down to your garage, get into your car bed, because you're not going to have to be driving the damn thing. It's just going to be a battery on 4 wheels, or it could be a lazy boy and a TV or your computer. But I think commute times aren't going to matter as soon as you get to driverless autonomy electric vehicles, because who cares if you're sitting on your back patio playing on your smartphone, or if you're sitting in a box and you're going down I-10. I think the driverless cars, but here's what I see in Arizona. Most of the people that I've looked into, they wake up in the morning, they live out in the suburbs of where there's one dentist for every 2,000 people. They get in their car and they get on the interstate and they commute for half an hour to an hour, and they get out of their car downtown where now there's a dentist for every 500 people. And if they just would have got up in the morning and commuted the other way to an hour out of town, they could have found some town of 1,200 that only has 0 dentists, and those are the ones that are crushing it. I mean, if you commute from the suburbs to downtown, it's just getting tougher every day. And when you commute out of town, it's like shooting fish in a barrel. So they're commuting the wrong way. The DSOs have already written off the rule, because people are getting married 10 years later than they were World War II. They're not going to go to Eloy when they're single. They're a primate. They're trying to spread gametes with people, and they want bleaching, bonding, veneers. They want a big selection to find their gamete host. And so the DSOs will not go in there, because they tell you that even the offices they have in the rural, on any given day, 10% of their offices don't even have a doc. So they're done with the rural. So they've already given you their playbook. So if you're a graduating class from here and your best idea is to go up to North Scottsdale, what would you tell them? I know they believe North Scottsdale is the promised land. Jim, you're up in North Scottsdale. What would you tell them?
It's not. I mean, it's tough. It's tough because everybody believes it, and so they all wanted, like you said, Howard. They all wanted to come here. And as I was listening to you, I was thinking, I guess I would ask the guys, hey, what's your definition of success? Because when I think back, throughout my career, and certainly when I was, getting out of school, people would say, and he's still here today, it's like, oh, you're a dentist, you're rich. It's like, no, I'm not rich. I have a good lifestyle, but I'm not rich. I'm not a millionaire, but it's a good lifestyle. And, to me, that makes a big difference. So, if you want to have the big office with the marble columns and if you want to put another, $500,000 into your office, that's fine. But you got to understand that, you're going to be sweating it because you've got a lot of bills to pay. But like you said, if you're willing to start out and say, hey, I'm willing to go to the rural areas, and I'm willing to get down into trenches and work hard, and maybe I'm not going to make $500,000 the first year to, net to take home, but be realistic as to what your expectations are, Howard. I think that you can go to those areas, and I think you can have a heck of a time and a nice lifestyle. And, who knows? I mean, that's kind of what we did. We started out in New Hampshire, and after a number of years, we said, hey, it's time to move. I got my feet wet, and I was still learning even when I came out here. But you don't have to jump in and come to Scottsdale right away. It's hard because everybody wants to do it.
So, if you're kids and you wonder, like say the International Association of Orthodontics, it's in Milwaukee, Wisconsin. Where the ACD was, there was a Jack. Remember Jack? He set up most of these. He set up so many of these institutions all in his own backyard. But what would you recommend if they want to learn this ortho, to just go to iaortho.org? Is that what you'd recommend?
Yep. I would say go there if you wanted to learn some ortho. Take a look and see who the guys are that are giving, continuums. And I don't know right off the top of my head who all of them are. I know that there's some guys in Canada. Michelle Champagne is one of them, but Michelle's kind of stepped back. But I know he's part of some people up in there. But again, you may have. Yeah, I mean, you can speak English. They'll still do it in English, but you're going to have to go to Quebec to do that. There's guys here in the United States. There's Brock Rondeau. He goes all over, mostly up in the Ontario area. I can't think right now of guys that are on the West Coast. None of them jump out uh, at me right now, but I would say, go online there, look, call Chris, talk to him, and just say, hey, I'm interested in getting into this. I want to learn. I want to start from the very beginning. Give me the names of some of the good instructors that I can take and find out who's nearby, or just look up and see who's doing something on a, single basis, a certain day that they're doing a presentation for a day or two on some topic, and go listen to those guys and see what you think. Start
Yeah.
that way.
Um, any other advice for the graduates from AT Still and Midwestern?
Uh, Boy, that's a tough one. It's hard. Like I said, I think be realistic, about your expectations. When you get out of school, you don't have to go out and buy the new, 3D cone beam. You don't have to have, a laser to mill all of your crowns in your office right from the very, very beginning. Get started. Find a place that you can work with. Ideally, if you can find somebody that you can work with, buy his practice, and have him mentor you for a couple of years, I think that's ideal. Take the knowledge that you and I've got in our heads, Howard, and be able to take that and say, here, let me put some of it inside of your head. Learn from those things that I've learned from, and then just keep growing from there. That would be my recommendation. That's hard. That's hard because a lot of guys who are my age just want to sell and just want to get out.
So what is your exit strategy? When are you thinking about well, how old are you, and when do you want to get out?
I'm 73.
You're
I'll be 70.
73?
Yeah, I'm 73. I'll be
Dude, you
70.
look awesome.
Thanks. I'll be 74 in March.
Wow. So God, now I want to hear what's the secret of looking that good at
Good
73.
genes. Good genes. We used to see my wife. She looks great too.
So good genes.
Oh yeah. People see her and they go, "Are you 60 yet?" It's like, yeah. She's
Wow.
my age. So,
Yeah.
what's my exit strategy? That's really what it is. That's what I'm working now is finding someone who will come in and will take over the practice. It has to be a good fit, and someone who's willing to start slow. They're not gonna land in my office and be working 5 days a week. The nature of my practice, Howard, is the only insurance that I'm involved with is Delta Dental. So everything that I'm doing pretty much is fee for service. They have insurance. It's about I think it's about 60% of my practice is insurance, but I don't take assignments on those. It's only Delta Dental.
Now, will the new person that buys your office and takes it from there, will he get the same deal from Delta? Is that transferable? Or
No,
is that not transferable?
Unfortunately, it's not. I'm Premier, and they've been trying to get rid of me for a couple of years now, and I won't. But the new guy that comes in, because he signed up and on his own, he's going to have to be non-Premier.
So the only clue I had that you were old.
Was when I went to dental school and I told you to build a new one.
No, it was whenever you have a doctor that has an AOL.com. I mean, that's just there's just no millennials that have an email with an AOL.
Where's an AOL.com?
Yeah, I have two AOL.coms for you. Did you know that? No,
do you really? Oh my gosh.
No, I have I got a Cox, I got a AOL. I guess I only have one AOL, but so are you looking for a person now? If there's a dentist listening to you now, tell them. I mean, you're talking to you're on a nice platform right now. They're looking for jobs. Make your pitch.
Yeah, I'm looking for someone who has the same values that I have, Howard. I think that's got to be number one. We have to have the same values, and then from there, it just has to be a good fit. It's kind of like dating, I mean, you go out with a woman and, she may be beautiful and everything. You go, oh my gosh, this woman is just fantastic. And it's just like, just didn't work out for either of you. And that's fine. you move on from there. And then sometimes you meet someone, and it was like I met my wife, and it was a blind date, and I went to the door, and she opened the door, and my mouth opened, and I said, "Oh my gosh, there is a God." There is this, and I told her that. I said it was love at first sight. It was like, wow. So, it's got to be that fit. I'm digressing here, but it's got to be a fit. We've got to have values. It's got to be somebody who understands that they're not going to come in. My practice doesn't have enough patients to support 2 dentists full time. It's going to be a situation where there's going to be a transition. If somebody wants to learn to do ortho, I'm willing to show them some things. I can't teach them the whole program. They're going to have to learn a lot of it on their own, but I can teach them what they know, what I know. I just want to take the experiences they had and be able to transfer that. I had a guy who was, he just graduated not too long ago from a Midwestern, and Bobby came in, and he was spending some time shadowing me in the office. And he sat down one day, and he said to me, he said, "Oh my gosh," he said, "I'm just amazed about the way that you can talk to the patients and the conversations that you have." And he said, "They don't teach us to do that in dental school." And those are the kinds of things that I want to be able to pass on. It's just like, you can sit there and just watch a conversation, and, I'll be happy to come in. If you don't like to do root canals, fine, I'll do them for you. If you don't like to do, certain procedures, that's fine. And if you want to do them, that's great. Go ahead and do them. But I want to just be able to be there to help somebody land with their feet running. That's my goal, Howard. And to be able to take my patients, who I've really developed a personal relationship with a lot of these people, is to be able to transfer them. It's that transfer of trust that Omer used to talk about.
So do you have a way to figure the multiple? Let me tell you a couple of things that I've seen in our backyard. People being burned, buying and selling houses. Number one, they go buy a practice and they don't have the skill set.
Yep.
Like they'll see somebody doing these big implant cases or crown and bridge case or whatever, and they technically can do it, but they can't sell the case, and they didn't realize that good looking, charming guy who was had a lot of energy and charisma, could sell these cases. And yeah, you could technically do them like a robot, but you couldn't sell them. So they would buy an office that's doing 1.2 million, and they'd pay like 1.2 million for it. And the first year, it didn't even hit 800. And you could have seen it coming a mile away. You didn't see that coming 30 years ago because the owners used to carry. Because the owners used to be like you and say, well, I wouldn't sell my practice to a sociopath for twice as much money. I really care about my patients, and the owners would carry. But I noticed as soon as the owners stopped carrying, and then it went to a faceless banking institution, Bank of America, Chase, whatever, now people they don't care who buys their practice. And if you got the money, you can buy my practice. And then the other bad thing that I see, and this is usually with your own mom or dad, is dad's doing $500,000 a year, or let's say he's doing 700. You come and work for him for 3 or 4 years. Together, you guys build that up to like 1.2, 1.3, and then he goes to sell you the practice, and he evaluates it of what you built it up to at 1.3, and he says that's what it's worth. So you go in there and you have a $5 dental office, and you build it up till it's worth 10, and then you get stuck to have to buy everything you work to build up. So those 3 things, do you have a way that you would, number one, do you have an exit strategy timeline? Do you want to be out of here? When do you want to be completely away or cut back?
That's a good question, because I like sleep. And so my goal would be that I would segue from doing full-time dentistry like I'm doing now to developing the sleep practice, because I don't have to do any drilling with that. I don't have to give injections. There's a lot that I don't have to do. There's no scalpels. There's no sutures. There's none of that that's involved. So I'm it's a lot easier for me. It's a lot less taxing for me to do that. So that's my idea, that I could do that. How long?
But would you just want to do that, sleep full time out of your office location, or will you?
Well, I don't think
go to other dental offices?
No, I don't think it'd even be full time. Again, because that's not really where I want to be now. I want to. Well, as soon as we can start to travel, my wife and I want to travel. We got our appetite whet when we were in Israel. It's like, hey, we want to go see Greece. We want to go see Italy. We want to go we want to go see the world. It's we're not getting any younger, so we want to do it while we can. Time wise, transition a year, 2 years at the most, I would say. I don't think it would take 2 years, but I could slowly decrease that time period that I was in the office, and stay up to a
So
couple
do
of
you
years.
have your practice listed right now?
Not officially, not
Okay,
officially.
because I want to tell you right now that, I mean, we're in the same town. This is Phoenix. This is 3.8 million metro. Urban dental offices are as liquid as a house. You put
Oh
up
yeah.
your house at the selling price, it's gone. I mean, you could list this today, and I mean, and have an offer, immediately. It's
Oh yeah. I've had
crazy.
I've had guys who have approached me already, and where I am with this, are you familiar with Collier and Associates in Ohio?
Collier and sounds familiar. Collier and
Yeah,
Associates.
yeah. Collier and Associates. He's an attorney. His dad preceded, and this is Brandon Collier now. His dad died a couple of years ago, but he's done financial investments and advice for dentists for years, as long as I've been in dentistry, and one of the things that they do is they do practice evaluations. They do lectures. They do, a lot of different things, anything related to finances and retirement. But they're doing a practice evaluation for me now, and it was supposed to be here yesterday. So it may be here now even, but I'm expecting it at any time. And I've talked to them about it, because part of it is I want to have an independent person evaluate it so that we can talk about these scenarios. Hey, I may think my practice is worth $800,000. You may look at it and say, hey, well, yeah, but that was pre-COVID. Now it's only worth $600,000. So how do we arrive at a realistic number? And being able to work with somebody like Collier and Associates and say, okay, let's structure a way that this can be a win-win situation for you guys, so that if you have a practice that is going to be closer to the $800,000, then that's what you're ultimately going to end up selling it for. But if the practice really has, plateaued at $600,000, then that's ultimately going to be the sale price. I don't know how they go about it, but we just talked about that, and so that it's a fair situation for both parties.
Okay, and on that note, thank you so much for at the end of your day, when any normal dentist would want to go home and turn on ESPN or have some dinner, and you stayed after work to talk to my homies for an hour. We went well over an hour. Thank you so much, James, for your time, your commitment to dentistry, and all the advice you shared with all the young kids in dental school today.